Imagine going for a routine pregnancy checkup and being told that you have diabetes, but you say you've never had diabetes before, you feel absolutely fine, you're eating well, you're active. So how is this even possible? And then you start suspecting that your doctor or that facility that they are up to something. No dear, it's totally normal. It could happen, and this condition is known as gestational diabetes mellitus. It's a condition that develops during pregnancy, even in women who have never had high blood sugar levels. And the truth is, many women don't even realize they have it until they've been tested. But once you understand what's happening inside your body, it becomes something you can manage and not be scared about. So today, that is why I have come. I'm going to break this down in a way that actually makes sense, what it is, why it happens, and what you can do to reduce the risk of occurrence. So quickly tap on the subscribe icon so I too can smile. How would you see this face and you don't want to subscribe to my channel? Yeah, subscribe. Thank you very much. So let's begin. During pregnancy, the female body goes through massive hormonal changes. The placenta, being the organs that supports your baby, produces hormones that helps the baby grow and develop. These same hormones can make your body resistant to insulin, and insulin is critical. It's what allows sugar in your blood to enter the cells where it can be used for energy. Think of your cells as having a door in front of them. Insulin is that key that unlocks the door so that sugar can enter the cell. But in gestational diabetes, these locks become faulty. The key is there, but the door doesn't open. Instead of entering your cells, sugar builds up in the bloodstream, and over time, that leads to high blood sugar levels. Now, here is why this matters so much. That extra sugar in your blood doesn't just stay there with you, okay? It crosses the placenta and reaches the baby. And when the baby is exposed to too much sugar, their body responds to this by producing more insulin. This can cause the baby to grow larger than normal, a condition known as macrosomia. A large baby might sound like a good thing, but it increases the risk of difficult vaginal delivery. It causes birth injuries and could lead to cesarean section. It doesn't just end there. After birth, the baby will still experience low blood sugar because they are still producing high levels of insulin without that extra glucose they were getting from the mother to support this supply. What makes gestational diabetes tricky is that most women don't feel anything unusual. There are often no clear symptoms, but when symptoms show up, they act like normal pregnancy symptoms, which includes increased thirst, frequent urination, fatigue, and blurry vision. And I actually spoke extensively about it in this video here. The main issue with gestational diabetes is that the symptoms overlap with normal pregnancy experiences. So it's very easy to miss them or tag them pregnancy symptoms. That's why routine screenings and antenatal visits are not optional but essential. Usually between 24 and 28 weeks of pregnancy, a glucose screening test is definitely carried out. So you'll be asked to drink either a sugary solution, and then your blood sugar levels will be measured after a set period. In this part of the world, nobody might give you a sugary solution to drink. Rather, we tell you to come with your urine, your first urine in the morning, catching it midstream in a cup, so we test for the presence of glucose or protein in the urine. If present, further testings are carried out to confirm the diagnosis. For every antenatal visit, we carry out this urine test for all the women present. Not all women are at risk of developing gestational diabetes, but there are certain women in certain categories. They include women who are overweight, those who have a family history of diabetes mellitus, women who have had gestational diabetes in their previous pregnancy, or those who have previously delivered a very large baby. Even women with no risk factor can develop gestational diabetes, so no one should assume they are completely safe. It's best to always test than to be sorry. Now, the good news is gestational diabetes is manageable, and in many cases it can be controlled without medication. Management focuses on keeping your blood sugar levels within a healthy range. That means eating balanced diets, not skipping food but choosing the right types of carbohydrates, proteins, and fats. It also means staying physically active. Something as simple as regularly walking can make a significant difference. Management also involves monitoring your blood sugar levels at home, so if you can get a cute small glucometer, it would go a long way. In some cases, if lifestyle adjustment is not enough, medication or insulin may be added, and that's totally okay because the goal is simply to protect both mother and baby. Mothers, also note that it's not about eating less, it's about eating smart, spacing your meals and avoiding excess sugar. Combining carbs with enough protein and staying hydrated can go a long way, and most importantly, following up with your healthcare provider consistently, because with proper management, most women go on to have completely healthy pregnancies and healthy babies. In terms of prevention, you cannot completely prevent the occurrence of gestational diabetes because the core driver is the placental hormones. But where your power lies is you can significantly reduce your risk and improve outcomes by managing factors you can control. And you can do so by starting your pregnancy at a healthy weight or as close to your ideal weight as possible, because going into pregnancy being overweight or obese equals a higher risk. So if you're planning on starting a family, check your weight and lose some if you have to, for your own benefit and safety. The second point is control weight gain during pregnancy, and this is often overlooked. Pregnancy is not a eat for two season, it's more like a nourish for two intelligently. Excessive weight gain worsens insulin resistance and increases glucose levels. So weight gain during pregnancy should be monitored and within recommended ranges. The third point is prioritize balanced low glycemic meals. If you don't get anything from this video, take this point. Your food should consist of complex carbohydrates, fiber-rich foods, proteins, and healthy fats. Avoid refined sugars, sugary drinks, and highly processed carbs. My fourth point is staying physically active, and this is very huge. Staying active is key. Even moderate activity can improve insulin sensitivity and help muscles use glucose effectively. You can go walking for 20 to 30 minutes daily and carry out light prenatal exercises. You don't need intense workouts. Please, you don't need intense. Consistency matters here more than intensity because you're very pregnant. Now to the fifth point, monitor high-risk individuals closely. This simply means if you've had it before, there's a family history of gestational diabetes mellitus, history of PCOS, or you've previously had a very large baby, go for earlier screenings and speak to your healthcare provider for closer follow-up care. The sixth point is don't skip antenatal screenings. This is very critical. As far as you've been scheduled for antenatal visits, please go, because it helps to detect conditions early and allow early intervention. Remember, you may have zero symptoms with gestational diabetes. And lastly, optimize your overall metabolic health. This includes getting good sleep. Stress management is very critical, and managing conditions like hypertension, because all these things can affect your hormonal balance and insulin sensitivity. Gestational DM doesn't always end with pregnancy. For many women, blood sugar returns to normal after delivery, but having gestational diabetes increases their risk of developing type 2 diabetes mellitus later in life, and that's why follow-up care after pregnancy is as important as care during pregnancy. So for a quick summary, gestational diabetes is not something you caused. It's a result of a hormonal change or hormonal changes during pregnancy that affects how the body uses insulin. It often has subtle to no symptoms, which is why testing is super important. And while it can sound scary at first, it is very, very manageable with the right knowledge and the right care. So if you're someone who is pregnant, don't ignore your routine testings, don't dismiss unusual symptoms. Also, don't think it's normal due to pregnancy. Ask the most annoying questions and seek medical help, because early detection makes all the difference. If this video helped you understand gestational diabetes in a way that actually made sense, subscribe to my channel and I'll see you in the next episode. Until then, take care of yourselves, take care of your health, and God loves you. Bye.